Hi, I'm Lainey and this is Noelle, and we are the doctors who are on the case of Ruben Tejada. He's a 31-year-old male who presents with pain when walking and running. He's a baseball player who slipped during a baseball game. So first we're going to talk about where the fracture is. It is on the fibula. The fracture is located on the shaft of the fibula bone. The fibula is the bone of the lower leg that is located in between the knee and the ankle. The fracture is found a third of the way up from the ankle and is found on the fibula bone.
So in the place that he broke his bone, the diaphyses will be affected, which is the cylinder compact bone that provides leverage. So the diaphyses includes the marrow cavity, the yellow marrow, the periosteum, which is this external sheath that covers the bone, the endostem, which is a layer of connective tissue that lines the cavity, and of course the compact bone will be affected. So often fat tissue from the bone marrow can leak into the bloodstream, which usually the body is good at getting rid of, but in certain cases, the patient can develop FES, which is fat embolism syndrome, where the body cannot rid the fat tissue from the bloodstream. Patients who have FES show signs of impaired lungs, a rash, and other problems with their brain and spinal cord, but this is, like I said, a very rare case, and we don't expect that our patient will go through that. We classify the fracture as a displaced fibula shaft fracture based on the x-ray.
Okay, so for our immediate plan, the patient will follow RICE, which is rest, ice, elevation. This happens right after the break to reduce inflammation and swelling. Next, we will need to put the bones back together, realign them. And so this process uses weights, pulleys, and ropes to apply gentle force and bring the bones back together into alignment. The traction can be forced to realign and stabilize the broken bones. Next, we will place the patient into a cast, which will go to a bent knee. It'll be a long cast, and the patient will need to stay off of their injured legs and use either crutches or a wheelchair if necessary. So our follow-up recovery plan, we will schedule x-rays to make sure that the patient's bones are healing properly. Because the bone has damage to the blood vessels, soft tissue, and nerves, it'll take up to 3 months to completely heal, but they should be able to begin putting weight on their bones around 6 weeks, a couple weeks in. So after that, we will put them in physical therapy because their bones will be stiff and they just need to regain movement and balance. And so this will involve just strengthening exercises. And once you're done with that, to prevent further fibula injuries, we suggest wearing appropriate footwear, following a diet full of calcium-rich foods, and doing weight-bearing exercises to help strengthen the bones.
So there are a few long-term effects to be aware of. These may include anxiety and depression, since it's not uncommon for traumatic injuries for these effects to develop. So this could stem from the fact that the patient will be temporarily unable to participate in baseball and some of the activities he was once involved in. So that's one thing to note. And then the other thing is that most fibula fractures will heal normally, but in certain cases there can be permanent nerve and blood vessel damage, but we also don't expect that to happen in this case.
So yeah, we wish the best for our patient. Thank you.
Thank you.